Hello, my name is Dr. John Kempton and I'm founder of The Extraordinary Practice. We train and coach dentists and dental teams how to implement an oral systemic platform into their dental practice. The key word is implement. This is what we know. Most all of dentistry knows there is a connection between oral pathogens and some systemic disease. Many dental practices have gone as far as telling their patients the connection exists, and in fact showing them a very nice chart or graphic that there's a connection between an oral pathogen and some systemic distant part of their body. Very few practices have implemented specific clinical practices into their daily routine that in fact deliver an oral systemic platform to each of their patients every day. What we do is fundamentally simple. We train dental teams to first identify and treat high-risk pathogens in high-risk patients, to ultimately minimize the impact of high-risk chronic disease like heart attack, stroke, and diabetes. Today we're in mid-Michigan and we're going to interview a dental team that was recently trained on how to deliver an oral systemic program by changing or adding to their current clinical practices. A few things you might want to know about this team. They get excited about doing great dentistry for their patients. They're from a very blue-collar community. And they had been very faithful telling patients that there was in fact a connection between oral pathogens and systemic disease, even showing them beautiful charts and graphs to drive the point home. Finally, there were skeptics among them. So let's meet this team, see what they think after completely incorporating an actual clinical practice that were designed to affect the overall health and wellness of each of their patients.
I don't often have the opportunity to talk with patients regarding oral systemic program. My experience is more with our hygiene team when they are talking about the results they're seeing in oral health of the patients that have gone through the program. Hearing the excitement in the hygiene team, seeing the passion that they have for this program is amazing. Knowing we are helping our patients work toward their goal of total body health is a great experience.
It's been a very good way for us to keep our practice healthy. We're seeing more and more preventative services as well as mainly periodontal services, and our patients come back over and over again because they know it's so important. We're finding fewer and fewer no-shows, and I think that the satisfaction in knowing that our patients are being really well cared for means a lot to me, and I think they have a great deal of trust in us as well. And so I feel like for those reasons and probably many other reasons, the oral systemic program is so important. It's a vital part of any dental practice.
When the oral systemic program was presented to our practice, I didn't really know how our patients were going to react. I'd been seeing many of them for about 13 years I had been here. And it was easy to present the material, the connections with the mouth and the body, and their subsequent visits actually proved to me that they were very interested. Their home care improved, they asked more in-depth questions, they were more willing to move ahead and proceed with procedures that they had been kind of sitting on the fence with. What I noticed is their perception of our practice as a whole improved a lot.
Throughout my dental hygiene education, I was told that we could never see bone regrow. With implementing the oral systemic health and the salivary testing, I've actually seen the opposite. With patients, we've seen 9mm pockets turn into 6mm pockets, and that was just the beginning process of them going through the program. I've seen bleeding points eliminated And with patients, they have a peace of mind knowing that the bleeding's gone, things are changing. Teeth that were once hopeless, there's actually a chance of holding on to. The peace of mind that they have is the biggest thing that we take away from that, whether or not they do have pathogens or they do not. And the enthusiasm behind it too. Not many patients are questioning why or what is this all about. They see the evidence and they're excited to do it. We've seen patients with A1C levels twice as what they should be, cut in half. So it's been a really great experience seeing patients better their total health.
The oral systemic program has helped me grow within our practice. I've been able to guide our patients to better health using the information that we have learned. I've become a better leader and have taken on the sleep medicine part of oral systemic health. With this education, I have helped people recover from excess sleepiness, dry mouth, difficulties with daytime concentration, mood changes, depression, irritability, improvement in blood pressure, and help control A1C levels. I encourage you to use oral systemic program.
Hello, my name is Lori and I am a periodontal patient. I'm also a dental assistant that has been in practice for 24 years and I've always lost ground with my periodontal disease. I've done everything right. I floss, I brush, go to the dentist every 3 months for my cleanings and I still kept losing ground. Had pockets 5 millimeters or more, bleeding, and just wasn't getting anywhere. And also lost a lot of recession as a result of that as well. I did have periodontitis as a child and was not diagnosed until I was 20. So with that said, I love the fact that oral systemic health has come into my life. It has made a huge difference. I do have cleanings every 2 months now. I don't have any bleeding. My pockets are 2 to 3 millimeters or less. I encourage you to talk to your patients, talk to them frankly, talk to them from your heart. That's what I do with mine. My patients, when they ask about what they can do to improve their mouth and the health of their mouth, I always bring up oral systemic health. It's not just an issue with your teeth, it's an issue with your overall health.
Hi, I'm Tracy with Extraordinary Practice, and I'm an oral medicine coach and facilitator with Launch Oral Systemic Health. I currently practice dental hygiene with a dental team that has implemented oral systemic medicine in the hygiene department. And I have to tell you, after 27 years of practicing dental hygiene, I finally feel like I have a tool that helps me individualize treatment for my patients with periodontal disease by targeting the bacteria that was keeping my patients from healing after performing traditional root planing and scaling only. The results I'm seeing from utilizing saliva testing has sparked a passion in me and has brought back for me my purpose as a hygienist. After 27 years and walking through that back door, thinking, here we go, another day of cleaning teeth, I now walk through that back door with purpose and knowing that I have the ability to help save someone's life. That for me is an excitement that I want to shout from the rooftops and share with you. Dr. Kempton and I have developed a curriculum with Launch Oral Systemic Health that will allow teams to bring forward overall health to their patients and the practice. It is the mission of Extraordinary Practice to add value to the doctors and dental teams we serve, and to do so with integrity, with excellent service, and with outrageous attention to detail. I look forward to meeting you soon.
We have implemented the Oral Systemic Health program for over a year now, and I guess I'll start out by saying that we've been beating our heads against the wall trying to fill the hygiene schedule, and we always seem to have openings that we just couldn't fix. And in all the coaching and articles that we read in journals said you have to create value, and if patients value the appointment, then they will show up. And we did as much as we knew to do in this area, and nothing seemed to really stick. I mean, we'd see spikes here and there, but nothing really worked for us. And it wasn't until we implemented the oral systemic health program in this practice that that value was truly established in the patient's mind. And their view of us as health professionals caring for their overall health needs, it just was really ramped up. They saw us not just caring for their mouths, but their whole being. And what I noticed is, many patients, when they came into the practice, they knew about the link between their mouths and the rest of the body. And when we would enter that discussion with them about their gum disease and other inflammatory conditions in their body like cardiovascular disease and diabetes, it just clicked. And for many patients, we're also providing saliva tests. They can see a report that shows what pathogens are causing the problem and how we can treat it. And what we discovered is that this report is much like an IOC of a tooth that needs a crown, where it shows a deep crack or cavity or a broken section. It really creates ownership. They look at this report and they say, I do have gum disease. Let's do something about this. This program has made our patients healthier, resulting in a healthier practice. I can't recommend this program enough. It has transformed the hygiene department in my practice, and as you know, when the hygiene department is healthy, the whole practice does well.
That was one great dental team. Their patients are so blessed to have them in their care. Here's a bottom line. Incorporating oral systemic practices into your hygiene program changes everything. Changes patient relationships, changes treatment plan acceptance, changes periodontal disease outcomes from day one, changes the systemic impact of periodontal pathogens on your patient's heart, pancreas, brain, unborn children, just to name a few. It will change your practice and the perceived value of your practice in your community. Finally, implementing oral systemic medicine means you understand oral systemic health, and that will change and empower you forever. Join the movement. Contact us. The process of change is so much easier with an experienced coach and just the right roadmap. Look us up at extraordinarypractice.com, Facebook at Extraordinary Practice. We look forward to hearing from you and thank you for your time.